What would you tell APRNs on how they can become engaged with health policy on a broader, scale?
Yeah. So, when I was growing up, I grew up in Canada, and I took a look at politics and health policy as something that was really not relevant to me or to my practice as a nurse. I have learned significantly since then that it certainly does have impact. And if I don't become engaged or have some activity involved in the development of health policy, let alone the implementation of health policy, then I may regret not having become engaged. We have a preface from an author that really charges us, and this was the goal of the book. Really, was to charge advanced practice nurses with the act of becoming more engaged in health policy, to look at. Why does health policy have relevance to them? The title of the book, the subtitle is Impact and Implications. And what I really wanted to do, and my co-editor and I worked on really trying to make sure that this was a boots on the ground kind of approach. How does health policy currently impact what we do as advanced practice nurses? How can we help to shape that health policy so that it doesn't have a negative impact, but instead has a positive impact? Um, Nurses of all genre, advanced practice nurses in particular, need to be very aware of what's happening in health policy within their state. They can have policies that are developed that will have a tremendous impact, either positive or negative, on their practice overall. If they do not become engaged in how that policy is being developed or how it's being implemented, then they will only regret later that they didn't become engaged earlier in the process and help to mold and shape it. Health policy it will always be. We simply need to identify how it's going to impact what we do and hopefully work to ensure that it has a positive impact rather than a negative one. If we don't become engaged, it is our fault. This book is really, I hope, an effort to try and impress upon people the fact that we have a role to play, a very strong role to play in how health policy is shaped and how it impacts us overall.